Zang, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross. Chapter 3 Substances. Patterns of disharmony of the substances. The four main patterns of disharmony of the substances are deficient qi, deficient shen, stagnant qi, and stagnant shen. Table 3.4 compares the patterns of deficient yang, deficient yin, and the four main substance disharmonies. In addition to these 6 main patterns of disharmony, there are also the 4 relatively less important patterns: Deficient Jin Ye, Deficient Jing, Deficient Shen, and Disturbance of Shen. Deficient Jin Ye. This category is usually included under patterns of deficient yin, deficient heat or excess heat. However, it's not necessarily associated with patterns of heat. For example, loss of blood, vomiting, and diarrhea may also involve loss of Jin Ye. Signs of deficiency include dryness, thinness, and frequently signs of heat. Deficient Jing. Either or both of the yin or yang aspect of Jing may become deficient for a variety of reasons discussed in Chapter 7 on Shen. Associated signs involve problem of reproduction and growth, and of this tissue relying on Jing for nourishment and formation, for example bones, she, brain, ears, etc. Deficient Shen. Signs of deficient Shen may be associated with general deficiency of qi and jing, or more specifically with a variety of deficiencies of Shen. The signs include dullness, apathy, and lack of spirit, vitality, and joy. Disturbance of Shen. This pattern is often associated with deficiency of Shin Yin or deficiency of Shin She, or with extreme heat and flame. Signs such as restlessness, insomnia, irritability, confused speech, extreme mental disturbance, and loss of consciousness may occur. Further ambiguities. A common area of confusion for Westerners lies in the overlap of the patterns of disharmony of yin, yang, qi, and she, outlined in Table 3.4 above. There are 4 overlapping continua: yin and yang and qi, yin and she and qi. These 4 continua form the basis for an understanding of Zang pathology. It is most important to be able to differentiate between the 2 possibilities in each of the following 5 pairs of patterns of disharmony listed below: deficient yang and deficient yin, deficient qi and deficient yang, deficient qi and deficient she, deficient she and deficient yin, stagnant qi and stagnant she, deficient yang and deficient yin. This division into deficient yang and deficient yin is the foundation of Chinese pathology. Deficient yang is associated with signs of cold and with an accumulation of fluid due to lack of yang to move qi and she, and to transform and move Jin Ye. Deficient yin is associated with signs of heat and with deficiency of Jin Ye due to lack of yin to control the heat, with resultant damage to the fluids of the body. Hence, the difference in the signs of these 2 patterns as shown in Table 3.5. Table 3.5. Comparison of the signs of deficient yang and deficient yin. If deficient yang, the heat-cold sign is chilly. If deficient yin, heat-cold signs is feverish. If deficient yang, urine signs are clear and copious. If deficient yin, the urine sign is dark and concentrated. If deficient yang, the feces are loose and moist. If deficient yin, the feces are dry and hard. If deficient yang, pulse signs is slow. Deficient yin, pulse sign is rapid. If deficient yang, tongue is pale, moist, and flabby. Deficient yin, tongue signs are red, dry, and thin. However, there are situations where the patient may show signs of both deficient yin and deficient yang. This is not referring to the conditions of illusionary cold and illusionary heat, which are very severe acute or crisis situations, but to the less severe conditions of chronic deficiency that form the bulk of Western practice. There are two main origins of the simultaneous occurrence of signs of deficient yin and signs of deficient yang. 1. Deficient qi and deficient yin. For example, a case where there is a deficiency of yin relatively to yang, but an overall deficiency of qi. Although there may be signs of hyperactive yang in the heart at the heat in the upper body due to inability of yin to control yang, there is not enough qi to perform the relatively yang functions of activation, transformation, and movement, resulting in lack of energy and in chillness, especially in the lower body. Number 2. Deficient yin of some Zang fu with deficient yang of the other Zang fu. For example, depression of gan qi aggravates a condition of deficient qi of pi and deficient yang of pi. However, depression of gan qi may also give rise to hyperactive gan yang and blazing yang fire. Hence, signs of heat and excess may be associated with gan, at the same time that signs of deficiency and cold are associated with pi. These two origins are often intermingled, and in such patients, sometimes deficient yin may predominate and sometimes deficient yang, depending upon conditions. For example, in conditions of malnutrition and external cold, deficient yang may predominate, whereas in condition of external heat and emotional stress, deficient yin may predominate. Deficient qi and deficient yang. Yang is broader, more fundamental concept than qi. The division into yin and yang, fire and water, heat and cold, lies at the heart of Chinese medicine. Since qi is just one of the aspects of yang, the signs of yang deficiency generally include the signs of deficient qi, but since deficient yang may also be seen as a progression of deficient qi, these shared signs are usually more severe in the case of deficient yang. In addition, deficient yang has signs of cold and damp. Deficient qi and deficient Shen. The qi-Shen relationship has already been discussed. Due to the nourishing function of both Shen and yin qi, deficiency of both qi and Shen will lead to weakness of body and pulse, and to paleness of face and tongue. However, due to the relationship of qi with yang and of Shen with yin, deficiency of qi often has signs of cold, whereas deficient Shen often has signs of dryness. Hence, deficiency of Shen may have the thin emaciated body, thin pulse, thin tongue, dry skin, and dry hair, associated with reduction of fluids. Nevertheless, deficient qi and deficient Shen commonly occur together, especially in cases of chronic debility. Deficient Shen and deficient yin. The relationship between deficient Shen and deficient yin is not the same as that between deficient qi and deficient yang. There is an intimate association between yin, Shen, and Jin Ye, so that both Deficient Yin and Deficient Shen have signs of dryness. However, although Deficient Shen is often associated with Deficient Yin and signs of heat, this is not necessarily the case. Indeed, a common distinction between the two patterns is the presence of or absence of signs of heat. Although Yin and Shen form a continuum, there is a qualitative difference between them, greater than the difference between Qi and Yang. Also, although Shen and Yin share some signs, for example, those due to the reduction of fluids, Deficient Yin does not tend to include all the signs of Deficient Shen, as Deficient Yang includes the signs of Deficient Qi. Nor is Deficient Yin necessarily a progression of Deficient Shen, nor is Deficient Yin a much deeper pathological phenomenon than Deficient Shen, although Deficient Yin is a more fundamental concept with a broader application. Stagnant Qi and Stagnant Shen. Stagnant Qi and Stagnant Shen may have common origins, and the latter is often a progression of the former, especially in the sense of increased severity and immobility of signs. For example, since Stagnant Shen is more material than Stagnant Qi, if there are palpable lumps, these are harder and more persistent than in the case of Stagnant Qi. Also, with Stagnant Qi, there is distension and soreness, which may come and go and change location. Stagnant Shen is characterized by severe pain, which is stabbing, constant and or of fixed location. Since obstruction is more material and more constant in the case of Stagnant Shen, the pulse is fuller and the tongue and complexion darker. Summary: an understanding of nature, physiology, pathology, and interrelationship of the substances is basic to an understanding of Zang Fu. This chapter has briefly considered the 5 basic substances of TCM, their formation and patterns of disharmony, in terms of yin-yang and of Zang Fu. Areas of ambiguity and overlap have been discussed, especially between the different pairs of substances and between the different pairs of patterns of disharmony of the substances.